every one of my patients is told by me that what I believe the new standard of care is an automated capsulotomy. I always tell them that it provides better centration, it provides more accuracy, you have a better chance of not needing spectacle correction when we're done. And then also I talk about the safety factor of automated capsulotomy, being that, we are going to negate the riskiest step in cataract surgery, in my opinion. If you don't do a good capsulorhexis, everything after that is substandard. And I think the last thing that I tell my patients is that I wouldn't do surgery on a relative of mine without doing an automated capsulotomy of some sort. I just think that if we can decrease any amount of complications and make things more accurate, that is paramount to having a successful refractive cataract practice like we do. So my patients, no matter what package we are discussing, I tell them the differences between femto and zepto, in that certain patients are going to benefit more from one versus the other, especially if astigmatic correction is needed. But the biggest thing that I explain to them is that they need to understand that it's an automated process that makes those steps in cataract surgery safer and more accurate. Most of the time when I talk about my packages with patients, I talk more about outcomes with those packages. I will explain that our first package is going to give you great distance vision. You're still going to need readers up close, for those patients that don't need astigmatic correction. And then I explain, the middle package corrects astigmatism and is going to give you great distance vision. We'll possibly do a mini monovision there. And then our last package, I explain the outcome of not needing glasses for me. I speak more on outcomes, but I always define how those outcomes are obtained by explaining what the benefit is of doing the automated capsulotomies with either zepto or femto. We almost always use an automated capsulotomy technology on our patients. So it has provided a huge increase in revenue to the practice that we previously did not have. As far as OR time management goes, we all know that femtosecond can be quite time consuming, especially if you have a femto laser in one room and you're trying to go from one room to the other and doing femto in between. It can be very time consuming and stressful to do that. Obviously there's certain patients that you preferentially want to do femto on, but when it comes to those that, when you look at the difference between zepto and femto and what they're going to offer to the patient, and that there's going to be equal outcomes, then it's very easy to say I'd rather do zepto because of the time restrictions that you have in the OR. So it is way more efficient. You don't have to move the patient around you. You don't have to worry about the juggling act as much. I find zepto is, during my case, still faster than a manual rhexis. So it saves many minutes over a course of the day in the operating room.